Hello, everybody. Welcome to today's Natural Medicine Week webinar with Riccardo Galeotti. And Riccardo is going to go through movement and the functional biomechanics of our spine, hips, knees, and ankles. Riccardo is an ambassador for Natural Medicine Week, and we're so excited to have you here today, Riccardo. Thank you so much for joining us.
Pleasure, Natalie. Hi, everyone. And welcome to Today Move with Ease. This should be a great little webinar all about getting your body moving, particularly what it does when you walk. And that's what I focus on, getting you to walk better by moving your spine and every joint in your body in a nice way. Shall we start, Natalie? Shall we get on board and start going forward? Perfect. So this is all about moving your joints and giving you sort of tools that you can assess your own body, but also things you can do to change what they're doing and bring you more awareness about what your joints should be doing, particularly when you're walking. So if I get you, everyone to stand up if you want to, and just bring your attention to your feet and sense where the pressure is in your feet today. And have the sense that we have the big toe, little toe, and the heel as a contact point on the ground. And we want to make sure that there's equal pressure between the front of our feet and the back of our feet, which is the heels and the toes. So have a sense when you're standing there where you feel pressure. Is it more pressure on your toes, or is it more pressure on your heels as an overall concept of foot pressures? And then pay attention to your right foot. Is there more weight on the heel, perhaps on the right foot, or on your toes on the right foot? And if you don't know, then move your body to the right to bring more weight into the right foot and have a sense of where the pressure goes and just make a mental record of where the pressure is. Then if you come back to the resting position of your neutral, have a sense of where that weight has shifted to. And then move to your left-hand side and bring now weight into your left foot. And have a sense of, is that different to the right-hand side or right foot? Is the weight gone differently in that left foot compared to the right? And then come back to your neutral position and then think of where the pressure is. And if you want to write it down in terms of there's more weight in my heel, more weight in my toes, there's more weight in the right foot, or more weight in the left heel, it just gives you clues about what is happening. So if I turn to the side and lean forward, hopefully that gives you a sense that there's more weight, perhaps in your toes. And for me, it happens. If I lean forward, there's more weight in my metatarsals or my toes and my feet. Now, if I come back to neutral and lean backwards slightly, then I'm hoping that there's more weight in your heels. And for me, it's the same. Perfect. Now come back to your normal position. Now we're going to start moving your pelvis to see whether that changes the weight in your feet. So if you have a sense of your pelvis tilting forwards and backwards. And what I mean by that, if I get a model, that we're moving through our hip joint, tilting forwards and tilting backwards through our pelvis. And that changes our lumbar spine when we move. So if I turn to the side and think of my pelvis tilting backwards, we call this a posterior tilt. There should be a response in your feet, putting more pressure somewhere. I'm not going to say where it goes, but I want you to feel that in your body. And then if you tilt your pelvis forwards into an anterior tilt, that should have the opposite response in your feet. So posterior tilt should bring more weight to your heels, and anterior tilt should have more weight to your toes. And have a sense that if that occurs to you, so an idea of anterior or posterior tilt should change your feet pressures, and that gives you clues. So if all the weight's in your toes, potentially you're standing with too much of an anterior tilt. And if you're standing there with potentially a posterior tilt, there's more weight going to be placed in your heels. And again, it's just an awareness. The other thing to look at with your feet is how level your pelvis is. So if you bend one knee, and if you bend the other knee, hopefully the pelvis also drops on the other side. So we want to see whether our pelvis can hike and drop when we're walking. And this little assessment dictates if that motion is available. So if I put my hands on my pelvis and I bend one knee, in this case, my right knee goes down, my pelvis drops on my right-hand side. And have the sense that if that occurs for you. And if you bend the left knee, does that same motion occur in your left hip or left pelvis when you do that? And we want to make sure that is similar motion that you have left or right. And that allows you to work out, I'm going to just bring the screen down a little bit. If you're bending your knee, if your knee bend is equal to left or right, and that has an impact on your pelvis motion. So less motion in your knee potentially will have an impact on how your pelvis moves. Because that's what happens when we walk, right? We take a step forward and one hip drops to the other side and drops again. So we've always got this motion of pelvis moving up and down, which allows the whole spine to start moving when we're walking. So it's not a shift out or a shift across, it's a lateral motion straight down and up. So we just want to make sure that the left-hand side and the right-hand side tilt is equal, because that has a huge impact on your lumbar spine, because we want to make sure it's moving with your pelvis. Now, the last motion in your pelvis is a rotation. So that rotation that occurs, if we put our hand on our pelvis, we want to make sure that when we rotate to our left, the right pelvis is going forward and the left one's going backwards. And then we're going to rotate towards the right-hand side and the opposite happens. Our left pelvis goes forward and the right goes backwards. And we want to make sure that the left and right is equal. So if you look down and put your hands on your pelvis like a loose fist, you can see how much rotation you have. So if I rotate to the left, I can see my left hand going backwards, my right hand going forward. And if I do that to the opposite side, is that equal? Is there an equal rotation left and right when you rotate your pelvis? Because that's also important. As you take a step forward when we walk, we're hoping that the pelvis should rotate left and right as we walk, because we're not robots. So we have this 3D motion that happens in our pelvis, which allows our lumbar spine to start moving. So have a sense that now we've done a little bit of a check-in to work out if your pelvis can go backwards and forwards, if your pelvis can go down and up in a hike and a drop position, or if your pelvis can rotate left and right. So it gives you some really big clues about the potential motion in your hip joints, because obviously the pelvis and the hip joint is related by where it sits in the socket. So a hike and a drop and a tilt has an effect on the hip joint, and particularly a rotation has a nice impact on the hip joint and the lumbar spine.
I'm going to check you out properly, though.
So have a sense that what motion is most easiest, what motion is more difficult in that position, in that motion. If we come up to the rib cage actually does the same motion. So if I turn to the side and put my hands on my sternum, we want to make sure that our sternum and our chest can go down. We call this a flex position. And then if we go backwards, and we can extend our spine. So flexion and extension. So again, when you're sitting there or standing, which way is more difficult? Going down in that flex position, in that slumped C shape, or is it tilting your chest backwards in that extended position? Because we want to make sure that we have equal range going both ways. And then if we look at the side bend capability of our rib cage, and I say the rib cage because it's easy to feel than the actual spine itself. If I tilt to the side and I'm side bending my spine, in this case to the left-hand side, then the whole spine is side bending towards the left. And if I go to the opposite direction, which is my right, I want to see that feels the same motion going through it. Can I side bend to the right as equally as I can to the left? And an equal way to assess that is your sitting bones. The sitting bones are these bones that you're sitting with on the ground or on the chair that you're there. When you side bend to the left in this case, is there equal pressure in your sitting bones? We want to make sure when we side bend to the left-hand side, there's equal pressure in the sitting bones, not going past the range of what we should have. And then if you go to your right-hand side, again, do you feel that equal pressure in your sitting bones, indicating that we are not going off center, but we're staying on center and staying true to our pelvis position. Because to me, that makes it easier to move our spine, knowing we have a fixed point in our pelvis. Now, the last thing to move is a rotation in the rib cage. So again, I'm going to keep my pelvis attached to the chair and rotate my spine, in this case, to the left. And just see what that feels like. All your abdominal muscles are getting a nice rotation, back extensors are turning as well. And then rotate to your right-hand side and see if that feels different. And again, you can feel the contact point in your sitting bones. When you rotate to your left, do you feel equal sitting positions in your sitting bones, equal pressure? And then when you go to your right, do you feel that sitting bone position and pressure equal? Sometimes we side bend as we rotate, which changes the pressure in the sitting bones, which gives you a great indicator about where and how you're actually rotating. Perfect. So now we've moved the pelvis and the rib cage in those 3 different ways. We're going to start doing the head now. So if I turn to the side and I'm going to move from my ears, we're going to bring the chin down, not bring the neck forward, but sort of bring the chin down. That means the back of the head goes up towards the ceiling in this position here. So that's a flexion that's occurring. An anterior tilt happens in our chin. If I go the opposite way, which is tilt backwards. So tilting down and tilting up. Which way is more difficult? Which way is easier? Which way do you feel that most tuned to in a way? And we just want to make sure we can achieve both motions, and both motions feel comfortable and safe when we do that. The next one is side tilting. So from your nose, we want to make sure that you can tilt to your left and tilt to your right in a nice, easy fashion. And if you can see yourself in the screen, which I can as well, I can actually measure and see which way is easier and harder by the amount of my ear coming down to my shoulder. So I don't want to get my neck involved in this motion. I'm purely trying to move through my skull as I do that motion. And again, we're just feeling which one's easier, which one's harder to do. And the last one is rotation. So again, if I use my nose and turn my nose to the right-hand side, feel that motion that's occurring. And if I turn my head to the left-hand side, again, how does that feel compared to the right? Can I go further in one direction than the other? And hopefully that gives you a nice little summary about how to move your entire spine and get that to move. So now I'd like to bring a little bit of a routine that you can do for the whole spine and get all those joints moving in a nice synchronized way. I'm going to change chairs because the chair that I was on is going to change how my spine moves. I'll bring this further down a little bit so you can see what I'm about to do. So I'm sitting in my chair, and hopefully, Natalie, you can see my whole spine in the webinar there. And all I want you to do is tilt your pelvis forward, and forward means in an anterior tilt. You want to bring it forward in my anterior tilt. Let me know what happens to your rib cage. Does your rib cage want to tilt down, or does it want to tilt up in that motion? And then if you tilt your pelvis backwards in this posterior tilt causing flexion, does your rib cage want to come down with it, or does it want to come up? So just move your pelvis forward and back and have a sense of what does the lumbar spine or the pelvis do, A, to your lumbar spine in general, but B, to your rib cage. And then have a sense that when you posterior tilt backwards, what that does to your hip joint, because the pelvis is going more backwards, potentially causing an extension to occur in your hip joints, as opposed to bringing your pelvis forward, causing a flexion to occur in your hip joint. So for me, when I bring my pelvis forward, it causes this rib cage to tilt backwards, allowing my whole spine to be in this S shape. We call this extension in the spine. And if I bring my pelvis backwards in this flex position, my whole spine wants to go inwards, creating this C-shaped spine And we want to make sure that we can equally go forwards and backwards into that motion to allow all the vertebrae in our spine to start moving front to back in terms of extension and flexion. Now, if I put one hand on my rib cage and one hand on my belly, we want to make sure that both hands, I'll turn to the side a little bit, when I bring my pelvis backwards and I bring my chest down, both hands are moving towards each other. And that is, again, a flex position for the entire spine. And if I bring my pelvis forward in an anterior tilt and open up my spine so it extends backwards, both hands should be moving away. So pelvis going backwards, chest going down, both hands move together. And pelvis going forward in an anterior tilt, chest going backwards, creates this idea of an extended spine. Now, which hand for you is moving the most? Is it the bottom hand moving forward and backwards and the top hand not actually moving? Or is the top hand moving down the most and the bottom hand not moving? I want you to make sure that both hands are moving equally, either together or moving both apart. Because that makes sure that each part of our spine is all moving either separately, not as one block together. So have a sense for you, when you bring your pelvis backwards and your chest down, do both hands start to move at the same rate together? And then when we go the opposite direction, anterior tilt, flexing the whole, extending the whole spine, and the hand moving backwards, is there a sort of same opening, same motion in both structures? Now, the hard part for this one is getting the head to move as well. So think of the head and the pelvis, they should be moving in the same direction, A, when we walk, but B, also in this exercise. So if my pelvis is going forward, I want my head also to go forward. And if my head goes up, my pelvis should be going up as well. So we want to make sure that the rate of the pelvis going forward and the rate of my chin tucking is also the same. So pelvis going backwards, chest going down, head should be going up, and vice versa, pelvis going forward, opening up the chest and the chin going down. So now we're moving the entire spine in a similar way that when you walk, freeing up the whole spine. And I hope that little routine makes sense. And we want to make sure that there's a change in our body when we do that. So if you get back on your feet, and we stand there now, again, having both feet on the ground, is there a change in the pressure in your feet by you just moving your spine? Now, if it's hard for you to feel the pressure in your feet, perhaps again, try that routine of bringing all the weight to your right foot. Feel where the contact point now is. Has that changed? Is there more feeling perhaps in your heels? And if you come back to neutral and go to the other side, which is your left, feel that pressure change. Where has it moved to? Is it different than before? And then come back to the resting position and have a sense, does that feel like there's equal pressure or there's a different sensation in your feet than you previously had? So what I'm suggesting is you've just moved your whole spine in this flexion and extension motion, and that changes your center of mass in your spine, which also changes the center of pressure in your feet. So there's a direct relationship between changing or modifying your brain's capacity to find out where you are in space by doing this activity, and it should change the pressure in your feet. And I hope that makes a kind of sense for you to feel that. Now, there's two other motions that we can also do that will affect our spine. And if I put my hands on my pelvis and bend my right knee, I'm hoping that my pelvis drops on my right side. And then I want you to side bend also your spine to the left-hand side. So in actual fact, my pelvis is higher on my left and lower on my shoulder on my left, opening up and allowing all my spine to side bend towards the left-hand side. So I come back up to neutral and I bend my left knee. My pelvis is dropped on the left, encouraging a lumbar side flexion towards the right. And I'm going to copy that by side bending towards the right-hand side. So in the actual case, there's a tilt to my right up and my shoulders going down, allowing my whole spine to side bend towards the right. Come back down. So when you do this motion, I'm going to try it again on my right. I'm going to bend my right knee, my spine starting to go left. I want you to feel equal pressure in your feet, left to right. So don't feel like you have to push your pelvis out or move your spine. We just want to bend our right knee and side bend our spine to the left with equal pressure in our feet. So a nice, gentle side bend of our spine. Come back up. If you bend the left knee forward, pelvis is dropped on the left-hand side. And I want you to side bend your spine to the right, encouraging a nice side bend of your spine to the right. And come back. Perfect. If you can, just walk around a little bit, see what that does to your body. Come back and stand again and measure that motion in your feet has that sensation of where the pressure shifted, changed in your feet. And for me, I can actually feel my right heel more in contact with the ground than previously. So there's something that's changed in my body to feel my right heel more, which is interesting. The last thing to do now is rotation. So I'm going to get back and sitting down on a chair because I want you to really feel the motion that happens in your rib cage. So in this position here, I'm going to turn to the side so you can see what's going to happen. With my right hand, I'm going to reach forward. Keep looking at my hand as I reach. By reaching forward with my right hand, my whole spine is rotating towards the left. If I keep looking at my hand, my cervical spine is going the opposite way. And come back and try the other hand. Left hand's going forward. I'm looking at my middle finger going forward, and I get this nice rotation of my spine to the right-hand side. And you're going to measure the pressure in your pelvis to see whether there's more pressure in the left or the right, because we want it to be equal when we rotate our body towards the left. And when we rotate our body by reaching our left hand forward, again, we want that equal pressure to happen in our pelvis, indicating that there's no side flexion occurring, but a pure rotation from our head all the way down to our lumbar spine. Now, have a sense that when you rotate, bring your right hand forward, that every vertebra should be rotating towards the left. If I keep looking at my hand forward, my cervical spine should be moving in the opposite direction. And see if that feels comfortable and safe for you to reach forward. If I go the opposite way and reach forward and reach towards yourself in the mirror, you can see how there's a nice rotation occurring and my head is actually rotating towards the left. And if I keep my body straight, keep my head where it is and rotate this back, you can see how there's a nice rotation that occurs in your neck by just keeping it forward when you rotate this your rib cage. So let's bring your pelvis involved with that motion. So once you understand that slight rotation, if you stand up now and bring your left foot forward, if you bring your left foot forward, for me, my left foot forward, my pelvis rotates right. If you look down at your hands and bring your hands on your pelvis, that should be one hand going more backwards than the other, indicating that your pelvis is actually rotating towards the left. So to the right, if my left leg is forward. Then my right hand's going to reach forward and reach. So my rib cage now is rotating left and my pelvis is rotating right. Again, that spiral rotation that happens in our body. Come back out, change feet, bring your right foot forward. That means the pelvis is rotating left. Left hand is going to go forward and reach forward. And have a sense that if we reach forward, our rib cage is going left. So right, the pelvis is going left. And there's not a lot of rotation. Once the pelvis and the rib cage are doing two opposite things, you can see that you can't really get a lot of rotation that occurs in your spine. Now change feet one last time. Bring your left foot forward, right foot behind you. And I'll see whether I can get the whole shot of me doing it. So you can just see. So left foot forward, right foot behind you. And then we're going to reach for our right hand going forward. And this time I want you to reach without your pelvis rotating. So your pelvis should be fixed. And you're going to reach forward to a point where it just nudges your pelvis forward. And that's your maximum range of rotation. So the whole spine now is rotating towards the right. I'm going to take a step forward with my right leg forward. Left hand's going to go forward. I'm going to reach forward now towards you. My pelvis has gone left. My rib cage has gone right, indicating a nice right rotation throughout my whole spine going forward. And then come back out. If you can, just walk around a little bit because things have changed in your whole spine. Come back to your normal standing position and just have a sense of what has changed in your feet. The pressure that is. Do you feel more weight equally dispersed throughout your whole body, your whole feet? Do you feel more weight distribution in your toes, your heels, or just a general change? So if you've got a question or so forth, you can bring that into the chat, the room there that Natalie is monitoring as well. So the next thing we want to do is think about our feet. We want to think about bending our knee to incorporate this motion that happens in our ankle joint. And then we're going to come up on our toes to do the opposite action of our feet. So we want to bend our knee to flatten our arch, which changes the ankle joint into this dorsiflexion position, ankle change. And then we want to lift our toes up and change the ankle position and see what happens. And that'll have an impact on our knee and our hip joint as well. So I'll get the computer set up so you can see me doing that action. I'm going to step back. Apologies, you can't see my head. But in this position, my right leg is on the ground. And I want you to think about bending your knee forward over your big toe, bringing your shin bone closer to your foot in this position. And when you do that, you can have a sense that hopefully your arch should go down and your knee goes forward, and you have a closing of the joint in your ankle and a sort of closing the joint in the back of your knee as you bring weight forward. And then I want you to come backwards and then straighten your knee. And when you straighten your knee, you should have a feel that your arch should increase in height as you bring your knee backwards and straight. As you go forward, we want to make sure we can close that arch and ankle and bring some angle in your knee. And then going backwards, straighten your knee, and really thinking about lifting the arch up by just bringing your pelvis slightly backwards when you're doing that motion. Now, this time when you do it, I want you to keep all the weight in your heel as you bring your shin forward. Shin forward, keeping the weight in your heel, and don't let it come towards your toes, and see whether you can actually feel the heel tilting down towards the ground as you feel that motion. And then as you're coming back, keep all the weight in the toes as you bring the pelvis back. And that's a nice way to get mobility back into your feet, allowing your ankle to move and also encouraging knee motion. And then you're doing the opposite as you go backwards. I'm going to turn around and do my other foot. Again, I'm going to keep in a nice split stance position, keeping all the weight in my heel this time. I'm going to bring the shin forward. And this is a little bit more difficult for me. I feel a little bit more restriction in my left ankle compared to my right. As I go backwards, I'm going to straighten the knee and feel that arch rise as I go backwards. Shin forward, weight collapses, arch collapses, sorry, and the weight goes into my toes. Coming backwards, weight stays in the toes and going backwards. So do you have a sense that it's really difficult to keep all the weight in your heel when you bring your shin forward? A lot of people find it difficult to keep the weight in the heel, and the heel comes off the ground. So it's really important to keep the weight in the heel as you bring your weight forward into that foot. And as you go backwards, keep the weight in your toes as you try to lift your arch by bringing your pelvis backwards. And this is a nice, easy way to get motion into your foot by bringing mass into it and then coming back out and changing the angle of the foot by increasing the arch height. Now, the other aspect of opening up the heel, opening up the ankle, if I turn to the side and keep my toes on the ground, but lift my heel up in just one foot. So the other foot's going to be on the ground, and just lift the heel up. And when you do that, I'm going to bring the camera a bit closer so you can see my foot. is just think, I want you to keep the toes on the ground as you lift the heel up. And it's doing a traditional calf raise, but the other foot's going to be on the ground. We're just opening up one foot and lifting up. And you can have a sense that your ankle joint opens when you do that. So try to keep your pressure on your big toe as you lift up. And you can see how that opens up your ankle as you do that. So from the other side, we're trying to do that opening of the ankle as you go up. Now, if you swap sides and try to do the other foot, is there a difference between the heel raise in your left foot, and this is my left, compared to the right? Can you have a sense that the fifth toe and the big toe should be on the ground as you lift up? And you'll feel that in your calf as well. So we want to make sure that the big toe stays on the ground and not come off it. So we're not lifting up the heel to come out, but we're really thinking about that nice opening motion through here. Because that's what happens when we push off. We need that ankle to open as we come forward in this aspect to here. So if we incorporate both of those motions into an activity, we can think about coming forward and bending the knee, bringing weight into the foot, coming up and opening up the ankle. Coming down, bending the knee forward, bringing weight into my foot, standing up, lifting up the heel. I'll show you from the front in this aspect. I'm going to bend my right knee forward, bring weight into that foot, standing up. Other foot's going to be supported and lifting that heel on the right foot. So really thinking about closing the ankle, flattening the arch in this position here, and coming up, lifting the heel. Let's try that on the left-hand side. Bending the knee forward, standing up, lifting the heel. Again, from this angle, I'm going to bend my left knee, bring weight into my leg. Other foot's going to be supported, lifting through that heel. So we call this a pronation motion. When the foot hits the ground, it spreads and loads, the knee bends and the whole body is supported by one leg. Then it comes up, does the opposite action, which is pushing you forward. So it's a nice easy way of getting strength in the ankle, knee, thigh, and glutes in this activity. And then once you get the strength, to start really pushing you forward. Because that's how we walk, we're pushing forward and we're bending your knee. Two activities that are sort of needed when you're walking and getting those motion to happen in your feet. Perfect. Have a bit of a walk. See what that feels like in your body. We're going to come back now to your foot pressures and have a sense if anything's changed in your feet. Do you have more weight now in your toes where you didn't have that weight, or more weight in your heels, more weight in your left foot, or more weight in your right foot? And have a sense that does that feel different? Because we've moved just about every joint in your lower leg and your upper body with those activities. So it looks pretty simple, but in those details, there's a lot of things happening, a lot of joints that are moving, and it's for you to feel the change that you're occurring in your body. So let's go back to that original assessment that we've done. If I stand there now, and if you tilt your pelvis backwards and forwards, do you have a sense there's a change in your feet pressures? Do you have a sense that when you bring your pelvis forward, for me, there's more weight now moving into my toes. Now, when I bring my pelvis backwards, there's more weight now that's occurring in my heels. So there's a different motion that's occurring in my feet than previously experienced. When I bend my knee now, I bend my right knee, my pelvis drops. I have a sense that my whole spine wants to actually turn into it and bring more weight into one side. So there's a reciprocal motion that happens in my spine now when I bend my knee. So my whole spine is starting to change by me just bending that knee. If I bend the other knee, it's a little bit more hampered. So it's harder for me to bend my left knee to get my whole spine to go towards the right. So in theory, it's harder for me to get my right foot forward when I walk, just because it's harder for me to get that motion forward. If I take a step forward now with my left foot, I'm hoping that there's a little bit more rotation that occurs in my spine. If my left leg's forward, my spine should rotate towards the left. And when I bring my right leg forward, again, there's more rotation that should occur in my right. So again, it's something to play around with. When you're walking, you want your arms to swing freely, which indicates if there's motion occurring in your upper thoracic spine, because the arms are dictated motion by the motion that's available in your entire spine. So it's just something to think about when you're walking. Perfect. Any questions or concerns with all those motions that we've done? Before we go any further, does anyone have any questions regarding those motions, Natalie, that we've just gone through? Because there's a lot of motion that we've done for your spine and your feet. Does anyone have any pressing questions they'd like me to answer before I go into something more complex than we've done?
I've just been checking. There's been no questions yet, but if someone does have a question, please do type them in the chat function, please.
That's
If
okay.
there's no questions, you can maybe move on, Riccardo, if you'd like to.
Fantastic.
Oh, here we go. Or someone said all interesting.
All
Fantastic.
interesting. Love it. Perfect. Okay. So let's work on getting a little bit of hamstring length into your body, which is a nice little exercise to work out what your hamstrings do when you walk. So I don't know if you noticed, but when you walk, we want the heel to hit the ground first when we walk. And we want the heel to hit on the outside, not the inside when we're walking. So have a sense, if you've got the room, when you're walking, we want the heel to make contact with the outside part of your heel, not the inside part. So we want to hit the outside, if I go forward, the outside, not the inside when we're walking. So a nice way to think about getting motion in that heel is to bring a nice tilting back action. So I'm going to hold on to something. You can use your chair. I'm going to do my right foot. If you bring your left foot backwards, you're going to tilt your heel back. Think about bringing your pelvis backwards. And in this case, it should feel your back of your knee straightening and a sense of a tightening the sensation in the back of your hamstrings. And then come forward, bring your foot on the ground, and again, try that knee bend. So we're bending the knee and the foot is flat on the ground. Coming backwards, straightening the knee, lift the toes, and rock on that ankle, hold onto something and bring your pelvis backwards. And that should think about loading the back part of your hamstrings and having a sensation that there's a different sensation in the back of your heel, back of your hamstrings. Then coming forward, bending your knee, doing the opposite action in your foot and your knee. Coming back, straightening, pelvis backwards, really reaching forward if you need to, and have a sense that the whole back of your hamstrings is nicely loaded. Now, if you've got a moment, have a bit of a walk and see what changes in your heel strike. Do you have a sense that your heel strike is more pronounced when you walk? And then come back and we'll try the other leg to see if there's a change as well. So I'm going to hold on to something, take my right foot backwards, lift my toes, and I'm going to rock on that heel. This time the left one, knee's going to be straight, and pelvis is going to go backwards. And for me, I can feel that nice load sensation. So I'm not bringing my chest down, but I'm bringing my pelvis backwards. So if my heel doesn't move, my pelvis goes backwards. The whole back musculature of my body is starting to load. Come forward, bend the knee, and bring my heel over my big toe. Coming back, straightening, pelvis backwards. So this is getting my whole back nice and straight. My knee is fully extended or straight. As I come forward, weight in the heel, knee going forward, bending that knee. Coming back out, straightening, pelvis going backwards, lifting the toes, and keeping that leg nice and straight. Perfect. Have a bit of a walk, see what changes, see what happens in your feet when you do that motion. And for me, I can really feel the heel contact changing in terms of it's quite pronounced. We need that heel to make contact with the ground because that's the first thing that should hit the ground, more on the outside than the inside. Perfect. Okay, so let's now just work on one little ankle rotation, because I think rotation of the ankle is one of the key parts of when you walk, because it allows the whole leg to start to move. So I'm going to stand with both feet underneath my hips, and all I want to do, I'll show you a big moment so you can see what I'm going to do. Here is just rotate my pelvis to the right. Right's on this side. And try to keep both feet on the ground as you rotate through your pelvis. And if you rotate to the left, keep both feet on the ground as you rotate. And when you rotate, think about where the rotation occurs. Is it more from your pelvis going backwards or more from your pelvis rotating forwards? And what I'd like to see is think about your pelvis should be going forwards as it rotates and not backwards when it rotates. It's a different motion. So when I rotate my body to the right, I'm getting my right pelvis to be still and my left pelvis is rotating forward. I can feel the rotation in my ankle going right as well. So try that to the left-hand side. My right pelvis is going forward, the left is going nowhere. I'm rotating around my pelvis on my left-hand side. Hopefully there's an ankle rotation. I'll bring the camera down to the ground so you can see my ankles. So feet is on the ground. I'm going to rotate to the right. My right ankle turns right. My left ankle turns right. So they're both rotating the same position, same direction. Coming back, feet on the ground. I'm going to rotate to the left. So my shin bones aren't changing direction. They're maintaining their position over my ankles. And that's just a different way of rotating. And my way of rotating is just thinking about keeping the whole pelvis over your feet as you rotate without shifting it left or right or over the whole pelvis. As we know that the ankles are really important in load management when you're walking. So when I rotate my body to the left, every single joint should be rotating towards the left. And then when I rotate to the right, the whole spine should be rotating towards the right as well. Perfect. And then we'll just assess your body one more time just to see if there's any change when you're standing there by getting your ankles to rotate and your hamstrings to load differently. What happens to your center of mass in your feet? Do you feel a change from the heels to the toes, or do you feel like there's more contact now on the ground than previous experience? Is there more weight in your right foot or your left foot? Do you feel like there's all opening up in terms of more pressure equally dispersed throughout the whole foot? And that's what I'm interested in, just a change. Can we move a joint to have a different experience? So you start to have more of these joints working for you, not against you, particularly when you're walking. So it brings out just a different appreciation of what the joints are doing when you're standing, but obviously more importantly when you're walking, which is what I'm crucial about. So how's that? Has anyone got any questions regarding what we've done to move your body, move with ease in that short little intro about 3D functional motion, moving your whole spine, feet, ankles, and your hips?
Sandra's got a question there. Would pain in the lumbar mean it is out?
It may be, depends where in the lumbar. It's really hard to say. We want to just feel if the motion tilting forward increases the pain or going backwards decreases the pain. And that then applies to also tilting left and right and rotating. So all those actions that we've done move the lumbar spine in a way that allows the motion to occur in your lumbar spine. And we know with the lumbar spine, the majority of the motion is always front to back motion. There is very limited, only 5 degrees of rotation and 5 degrees of side bending. So that the idea of increasing motion in the lumbar spine is not warranted. It's all about bringing it back to its normal limits. So I would suggest thinking about how much motion you have in your pelvis, how much motion you have in your rib cage, and bringing more motion in your rib cage to help the lumbar spine out. Hope that answers your question without going into too much detail. Lumbar pain gets, it's interesting because your center of mass is centrated in the front of L5, L4. So there's no muscle supporting your center of mass going forward. So it's all the muscles are predominantly in your back of your spine. So the more understanding of bringing your change in your whole center of mass changes the pressure in your pelvis. So it's something to think about. And that motion that we did today in terms of moving your whole spine changes where your center of mass is placed in your spine, and changes it more to being more appropriate for that load-bearing system. Feel more cemented. Great. Perfect.
And there's
Anyone
a question
else?
from Fiona. Yeah, so Fiona's asked, are these okay to do if your Achilles tendon has a slight tear that is slowly healing?
So that, be cautious about any tearing of muscles. We want to think about probably unload bearing. So on the ground, so your foot will be not weight bearing, and thinking about moving your heel perhaps on the ground. So you're thinking about load bearing the Achilles and shortening it without any pressure going through. Obviously, if you have torn it, you may be in a boot. So you just have to wait till it heals up before doing any load bearing motion through it. But again, we just want to make sure the heel can move through that area, and protecting the Achilles first. It has to repair itself before you can put any load or motion through it. But you would have thought of that getting more expert advice from your therapist as well.
And Vicky has asked, this looks as though it would be good for neuropathy in the feet. Is that right? Is there anything else you can do for this?
Yeah, obviously any motion that we can bring into the feet by changing your body's perception about where it is. So these are all motions about giving you guidelines and giving you sort of pointers about what you're doing, but more importantly, what you're not doing. So it's highlighting to your brain which motions are difficult, which motions are hard to do. And we just want to go into a motion back and forwards and see what changes and what awareness you have in those movements. So you're allowed to actually bring that motion back in a safe way. So if neuropathy is the sensations that you're losing, we want to change the nerve pathways to bring more sensation to areas and try to bring back that motion. And we've done a lot of motion in your spine and in your feet, just again, changing your center of mass, changing where your body thinks the pressure should be going and managing that differently to bring more awareness through.
And there's another question. Is there an alternative way to stretch the forefoot if you can't do a heel raise? And she's saying this is from an injury.
I put wedges in the feet to change the timing of the foot. So if that's your foot, and I'll change the camera angle. Excuse me. Let me get a wedge. So motion's about timing. So if we can change the timing of a joint opening and closing, that changes the muscle activation. So if you bring your foot up on a wedge, or it could be a towel, and you bend your knee forward, the muscles have to respond to a different stimulus, which is a change in the angle of the foot, which changes the motion that occurs in your arch. So I use wedges. You can use a towel, put it underneath your foot at different angles, mostly always on the inside, bend your knee forward, and the forefoot should actually change position when you bring mass into it, and actually turn it when you do an ankle rotation. So I predominantly use wedges to change the timing, but you can do that to change the timing of the forefoot when it makes contact with the ground. So yes.
Vivian says, thank you. She's feeling less tension. That's amazing.
Wonderful.
Any other questions? Please do type them in. Or is there anything else, Riccardo, that you want to leave us with as well?
I can keep moving the spine a little bit more. I think I had a client today about arms. Arms are really interesting because we can move the spine by moving the arms. So I think we can do that for a couple of minutes if you'd like to.
Please.
Change the way that we can move our arms. Because I think a lot of people putting on desks and not moving the arms. But I'm going to have my right arm going forward here, and my thumb is going to be pointing upwards. And if I bring my thumb and rotate it towards the ground, that causes an internal rotation. If I keep going, keep going, keep going, my whole spine is actually rotating away from my arm. And that's called a side flexion towards the left if my right arm's forward. And if I then turn the arm the opposite direction and keep my arm level with my shoulder and bring my thumb outwards, it brings an external rotation happening and actually pulls my spine into a side flexion towards, in this case, towards the right. And then rotate the opposite direction, using the middle finger as my reference point to turn around, rotate in, encourage then internal rotation and a side flexion towards the left. And hopefully you can feel that motion occurring, and then come the opposite direction. Big rotation, external, 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 and bring back that rotation away. So now if I do that on the other side, just as a comparison, again, I'm moving through my middle finger. It's rotating around, my hand's rotating around my middle finger, thumb's pointing upwards. And if I rotate inwards, turn, 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 again, I'm hoping that I get a rotation to the right if my left hand is upwards. And if I turn the opposite direction, external rotation that's occurring, my hand and my ribcage then is turning towards the left in terms of a side flexion out. And you want to sense that which way is more easy, which way is more difficult, if my left or my right is different when I rotate those motions. But what's really interesting, if I go backwards now, so you can see both hands in the picture. My left hand is going in, the right hand goes out, left hand goes inwards for the rotation, right hand goes out for an external rotation, and you can really see how that motion is now going through my spine. My spine's going towards my right hand side, coming up, getting an external rotation, hand is rotating away from the ground on my left, my hand's rotating in towards the ground, and I'm getting a rotation on my spine or side flexion towards the left. And it's a nice little way to feel motion in your arms. If I go the opposite direction, but really a nice way to get motion in our spine. So motion in our arms, motion in our scapulars, really brings motion into our spine. It gives a different appreciation of if you start to move your arms, your spine will work differently. But if you move your spine, then there's motion that occurs in our arms as well. So there's always a dual relationship between the arms and the rib cage with the arms. So I like to work with rib cage and motion first before looking at shoulder pathology. So it's a nice little easy way of rotating that to feel that motion forward. Hope that makes sense in terms of that arm motion. And you can do the same going forward. If you reach forward with one hand, that's an external rotation. And the other hand's going backwards, which is an internal rotation. So the more you reach forward, the more you reach back. Again, opens your spine in a different way. And if you do the opposite, reaching forward with your left hand, opening up, bringing that external rotation, and then the back hand is sort of internal rotating, reaching forward. And you can start to feel there's a rotation and side bending more so now when you do that. So in this case, I'm rotating towards the left and rotating, side bending towards the left and rotating right. Happens. Left hand now is going behind me, right hand's going forward. I'm externally rotating my right hand, internally rotating my left hand. And if I reach forward, I get different spinal mechanics happening, which just changes the mechanics in your spine, which we won't go into type 1, type 2 mechanics. A little bit more advanced than we get into, but you can just feel those different motions that are occurring. The spine's either rotating towards you and rotating, so side bending towards and rotating away, or side bending towards and rotating towards. It's two different motions that happen in the spine when you walk. But your arms have a massive impact on what the whole spine gets up to. It's a nice little routine. I can actually feel my arms getting more blood flow. So thanks for that. That was good.
And Sandra asked, should you do the rotation of each arm individually or together?
You can do them both together, both going in, and you can see if I rotate inwards with both arms, it creates a flexion. If I rotate my arms both out, it causes an extension. Or you can do one arm at a time, or both arms together, or both arms going in different ways. So it all depends on what you feel, what your analysis feels like. So we did an assessment. Can you move each joint? What does it feel like to move each joint? What's most difficult? And then based on what you can't do, you'll start doing exercises to encourage the motion through those areas. So you can do it all, or you can just do the assessment to work out what your body needs.
Amazing. Everyone's saying, excellent presentation. Thank you.
Wonderful.
Um,
Any other questions, anyone?
Yes, so someone said very clear demonstrations with movements. That's Fiona. Any last questions? We've got a couple of minutes left before we let Riccardo go. And everyone's going to get the recording as well. So I can see you all in your lounge room or somewhere doing all this again.
Yeah. I think it's an easy way of moving every single joint in your spine in a safe way. The goal is to work out what moves most, what moves least. Start moving the parts that don't want to move and just slow down the parts that move too much and just see what the magic happens in between that process.
And would you recommend everybody trying to do this daily or a couple of times a week? Or
I think if you sit down in a chair, each time you sit down in the chair, just do one repetition. Yep. One repetition of side bending or rotation, just to change what your idea of what neutral is. Because we want to change the motion in each joint. If we change all the motion in each joint and bring them back to neutral, then your spine's sitting in a better position. The more it sits in a better position, the more access it has to front and back, side bending and rotation motion in every joint. So more frequently, one repetition every hour is what I recommend, just to change your idea of what neutral is.
I think Christine's asked, I think she's asking, does this practice help with the feeling in the heels?
Yeah, so if you're not having any weight in your heels, then we need to start working out a way to bring more weight in that, because it's really important. Your heel has a direct impact on your pelvis motion. So the more you have this pressure, this motion in your heel and pressure in it, the more the brain realizes where it is in space and starts to change the mobility through it and the sensation through it as well. So the heel's really important. We need to get that in contact with the ground and you feeling that motion through it. Hope that answers your question.
Well, thank you so much, Riccardo. I think it's just been such a valuable movement session. It's so great to have a practical session and to really get our spines, hips, knees, ankles moving. So really thank you for joining us today.
Thanks, everyone. Thanks for being here.
And to everyone else, we do have some more events tomorrow, one more tomorrow and Friday to round up the whole month of our wonderful webinars for Natural Medicine Week. So please do go get onto those. We've got all the recordings as well available, as well as Riccardo's today will be sent out to you. Thank you all. Have a great afternoon.
Thanks, everyone.